WNST, Towson, Baltimore, and Baltimore Positive. Want to stop everything, give shout out to our newest sponsor, Wise Markets, for our intelligent conversations, now becoming wise conversations. We get up on Mother's Day and springtime and grilling out and doing all those great things. I'll be telling you more about that. The Crab Cake Tour is in the planning mode. We're past beta now. Like, it's going to happen. I'm going to zip line. I'm going to go fly fishing. I'm going to hang out in Assateague, and I'm going to eat Smith Island cake in Smith Island. But to kick it all off, to do it the right way, we're going to start at our sponsors at Faley's, of course, and Costas. Right around Preakness Week, we're going to be getting going with that in May. And we're also going to be with our friends at State Fair doing our first outdoor sort of socially distanced thing. Don and I get together like 4 times a week. We just do it virtually. Don, this is going to be a great segment here. We're going to learn a lot here about healthcare and people and hospitals. You know, I was a big part of this with my wife with in healthcare here with her 2 bone marrow transplants. I know that we have a person you know pretty well on the program.
Well, once again, I said I aged myself. I've known our next guest for many, many years. We go back a long time, and nobody in the state, this is not hyperbole, nobody's been more front and center than the president of Maryland Citizens Health Initiative Education Fund than our next guest, Vinny DeMarco. He has been on the front lines of all of these health-related issues for decades. So, Vinny, first time, not your last. Welcome to Baltimore Positive.
Well, thank you. Nice to meet you, Nestor. And I'm a big fan of Don Moeller. You did such a great job for Baltimore County, both as top aide for Kevin Kamenetz, and when my college roommate, college buddy, Kevin Kamenetz passed away, you filled in beautifully. Yeah. So the Baltimore County and state owe you a lot.
Well, thank you. Hard to, Vinny, you know, on another note, hard to believe that we are now weeks away from the 2-year anniversary of when Kevin left us. It just an awful night, that May the 10th. But hey, Vinny, before we get to all the serious stuff about Maryland healthcare and what happened in the General Assembly and talk about your organization, Nestor likes to ask everyone, he's going on this crab cake odyssey. You know, folks from all over the nation, if somebody flies into town and jumps off a BWI and tracks you down, where do you take them for a crab cake? They say, Vinny, take me to your favorite crab cake place. Where do you take them?
Now let me start by saying I'm a vegan, so I don't eat crab cakes. But my wife, Molly, loves crab cakes, and this happens. I've got a colleague in Texas who came to town. People come in. We take them to Coco's.
All right, there you go.
My neighborhood.
Place. All right.
I live just a few blocks from Coco's, and we love it. And they have a great vegan burger. So while everybody else is eating the crab cakes, they make for me this vegan burger that's wonderful. So I'd love to advertise Coco's on Hartford Road.
Well, we're going to get there. Brandon Scott's talked me into that. So I haven't had a Coco's crab cake since the 90s.
It's a great place.
I reached out to, it's amazing. It keeps coming up. I reached out to the mayor literally minutes before we connected with you this morning to see if we can arrange our schedules and have the mayor join us over there for a crab cake. I am sure that he will. Well, Vinny, talk about your organization, because this Maryland Citizens Health Initiative, it's been around for a long time, and we're going to have you talk about the things you've thought about. But tell our listeners who may have heard your name, but they don't know about your organization, where did your interest come from? How did you form it? And what the heck is it? Because it's so important.
Well, thank you again for this opportunity. Maryland Citizens Health Initiative was founded in 1999. Former Baltimore City Health Commissioner Peter Bielenson was our founder, a great guy, and we came together. And it was in the aftermath of the failure of the Bill Clinton, Hillary Clinton health plan at the federal level. When that failed in the mid-90s, it became clear that states had to do something. So a group of us, led by Peter, came together and formed this organization. And he recruited me because I had just come off successful campaigns on gun violence prevention and reducing teen smoking with cigarette tax increases. And we had put together a 6-point program, which really works to move public health policies. I like to tell the story that about myself, I've been working on public health issues for decades. And I've learned two important things, Don, is that no matter how difficult and unsolvable you think the problem is, there almost always is a public health way to deal with it that experts at the Johns Hopkins Bloomberg School of Public Health or the place have come up with. And the other thing I've learned is that the vast majority of Marylanders, and I think the vast majority of Americans, support these policies, but not everybody. And there's that small but loud minority that I come across all the time. I'll never forget my own neighborhood in Northeast Baltimore, where Coco's is, the Local Improvement Association. I had gone to get their support for gun violence prevention measure. They supported it. It was great. A couple of years later, I went back to get their support for increasing the cigarette tax by $1 per pack to reduce teen smoking. I'll never forget this really big guy in front of the audience got up and said, "Aren't you the guy who came after my guns? Now you're trying to take away my cigarettes. Next thing I know, you're coming after my ham." Well, I told him we would leave his ham alone.
It was burgers. It's burgers. Yeah. Steak, isn't it? Or is it burgers? Yeah. Which one is it?
Well, it's a he said ham. I told him we would leave his ham alone. Now, Nestor, I didn't tell the guy I was a vegetarian because he probably would have shot me. But we calmed him down, and the group endorsed our proposal and worked. But I just want to emphasize that gentlemen like him, and they're almost always gentlemen, not ladies, who oppose these measures are not the problem. They're a small, loud minority. The problem is vested interests with a lot of money. The gun lobby, tobacco companies, alcohol lobby, drug companies with a lot of money that often have a stranglehold on Annapolis, our state capital, Washington, D.C., state capitals all around the country. Well, over the years, we put together a terrific 6-point approach to overcome these opposition. The key is to make the issue an election issue. And we did it successfully on guns and tobacco in 1994 and 1998. So we got together and said, let's do the same thing on healthcare. So we created the Maryland Citizens Health Initiative, Healthcare for All Coalition. And over the last 20 years, we just had our 20-year anniversary a couple years ago. We've had a lot of successes, even before the Affordable Care Act. We expanded healthcare to over 100,000 low-income Marylanders through a Medicaid expansion funded by the tobacco tax. We raised the alcohol tax to fund more healthcare. And then really wonderfully, thanks to President Barack Obama's Affordable Care Act, we made sure that Maryland, under Governor O'Malley, Lieutenant Governor Brown, was at the forefront of implementing the Affordable Care Act correctly. And as a result, we've reduced the number of people uninsured in Maryland by half, from 13% to 6%. 400,000 people have gotten health care. But
so 94% of our population has health care.
Yes.
That's a big number. That's
a big number. It's a hell of a number, but 6% don't. About 300,000 or 400,000 people don't. And we want to work to get them insured. Now, we understand that there are still issues for people with insurance. You know, we want to make, it ain't cheap. We want to make sure. And one of the biggest drivers of keeping it expensive is high drug costs. And in 2017, we began a campaign to make prescription drugs more affordable in Maryland. And one of our key leaders was Kevin Kamenetz. He did a radio ad for us.
My wife is diabetic, so you know what I mean?
So she has that insulin cost. I mean, look, she exemplifies why we need to do something. But the drug companies take us for a ride every day. Americans pay dramatically more than people in other countries for the same drugs. And, you know, they say to us, Don and Nestor, we need these high prices for research. We need these high prices to get drugs that keep people alive. Well, we want to keep you alive with drugs, but our research shows that these fellas and ladies spend much more on advertising than on research.
Well, Vinny, you remember that?
You sound like Bernie Sanders, right. But you know, like it's all true. It's all true.
Yeah, Vinny will remember it. You invoked the name of our good friend, your college buddy, and my close friend, Kevin Kamenetz. Remember very well that press conference, Vinny, in Annapolis, and all the big pharma reps were out in that press conference running to, if you'll remember, running to the reporters afterwards to try to counter what Kevin and other leaders and your group was saying, because they knew it made so much sense.
Right.
That it's one of those issues, like you said, who doesn't think we pay too much for medicine in this country?
Right.
I've never met, I don't care if you're red, white, blue, purple, I don't care. Everyone thinks we pay too much for drugs, right?
Yes.
And Vinny, give us a little bit of that history, because you lived it. Unfortunately, this is how the sausage is made. My understanding is there would have been much, much more teeth in that proposal in the Affordable Care Act, but President Obama couldn't get Joe Lieberman and some others on board to really take on Big Pharma. I mean, he was ready to do it, but you got to get the votes, right?
Yes, it's a good question, and I love the Affordable Care Act. The 2009 Affordable Care Act, 2010 Affordable Care Act was one of the best laws passed in America since Medicaid and Medicare. Now, Joe Biden is doing better than that right now, which we'll talk about in a second, and building on that. But they decided that their goal was to reduce the number of people who are uninsured, and they reduced it by 20 million. 20 million Americans have health care now who did not have it before the Affordable Care Act. And they couldn't get that done and take on Big Pharma at the same time. It was just not possible. So they made a decision to focus on the expansion, which I believe was the right decision. But now it's time to move beyond that and take on Big Pharma and do what Elijah Cummings, God rest his soul also, wanted us to do, to make sure that Medicare can negotiate with the drug companies to keep prices down. Why Medicare can't is ridiculous. The VA negotiates, all the other countries negotiate, Care First, Blue Cross Blue Shield negotiates, but Medicare can't. So,
Vinny, is that as simple? I apologize for interrupting you, but Nestor said it is social studies class. Is because, again, you're right. The men and women out there riding around in their car now, listening at their computer, listening to their phones as they take their daily walk, they're going, wait a minute, why on earth the VA can negotiate drug prices? Why would the largest healthcare system in the United States, Medicare, not be able to do this? Is it as simple? Is the answer as simple that Big Pharma makes massive contributions to elected officials who will not let that happen? I mean, is it really that simple?
Yes. Now, what they say is we need those high prices for the research. And if we don't have the research, we won't be able to save lives. But it's not true. They spend their money on advertising. And no, we want them to do their research. And let me say something else about research, because this is important here. The drug corporations say we need these high prices for research, but a lot of their research is paid for by the federal government. That's why one of my heroes, Senator Chris Van Hollen, has put in this great measure simply called the We Paid Act. We Paid Act. And it says this: if a particular drug has a certain percentage, a huge percentage of the research on which it was based, paid for by the federal government, then the drug company can't charge whatever they want. They have to go through a board and be regulated on what they charge, which is only fair. You don't want to pay them when you do the research and pay them through the high prices. So the We Paid Act, in addition to the Elijah Cummings Medicare Negotiation Act, would help a lot. But let me just say about Maryland now. Thanks again. I want to thank all our local leaders, Johnny Olszewski and Calvin Ball and Stuart Pittman and all our leaders, and Mayor Scott, for really pushing this, and Barry Glassman helped, Jan Gardner, Langell Alsobrooks, Mark Elrich, all of them came together. We passed a great law in 2019, the first in the nation, Prescription Drug Affordability Board. This law created this board, which is in place now, chaired by a real great guy, former Health Secretary Van Mitchell, who's a real stand-up, wonderful guy. That board is in place, working to make prescription drugs more affordable for Marylanders. And the drug companies hate it, but they weren't able to stop it. And it's in place, working. For some reason, Governor Hogan vetoed a measure to give them the authority to pay for their work, but that was overridden this year. So they're in place. They're paying for their work, and listen to this: a dozen states are trying to replicate our success. So this Prescription Drug Affordability Board will start soon implementing ways to make prescription drugs more affordable in Maryland.
Vinny DeMarco is our guest. He is the president of the Maryland Healthcare Initiative. Did I say that right? No, I didn't get that right.
Maryland Citizens Health Initiative.
Maryland Citizens Health Initiative. I make sure I get that right. I want to talk about the vaccine and what's going on because, you mentioned these drug companies, whether the little blue pill with Pfizer or whether the Johnson & Johnson or whether the Moderna, these are brand names like Coke and Pepsi and Budweiser and Miller at this point, right? Like I got the Pfizer. I'm getting the second one next week.
Yeah.
For the drug companies, and I'm thinking they got rich off of this pandemic. You know what I mean? One way or another, I'm feeling like they got a shot in my arm. They're about to get a second shot in my arm, right? I would say nothing has been more important over the last 15 months than having this come to the front of all of us that healthcare and our health and our collective health is all intertwined. We spent part of the morning talking about all drinking the same water, literally, right? But when it comes to healthcare and, my wife and what it cost her at Hopkins, there were other people in beds next to her that couldn't get the same drugs and suffered because they didn't have the insurance that said you can have this drug, but not this drug, or only so much of this drug. We only have so many of these patches that keep you from throwing up. And my wife was giving patches to girls in the hallway to keep them from throwing up, right? So because she had insurance and other people didn't. This thing here where I have friends who can't taste cilantro anymore a year after this. My dear friend's daughter had COVID a year ago, early on. She has some heart issues, right? Like all of the fallout of all of this, nothing should bring people together more in this country than a pandemic that's affected us all, to realize that healthcare is right up there with food and water and beer. The most important thing we got going on here and the most expensive thing we have going on. And you realize that when your grandson is born with an issue, or when your wife needs a bone marrow transplant.
Well, Nestor, what you're saying is absolutely right. And I can tell you, all the polling I've seen shows that the vast majority of Americans, Democrats, Republicans, independents, liberals, conservatives, agree with that. They want the Affordable Care Act to work. They support what President Biden and Vice President Harris are doing. And I'm glad your wife had the health insurance. That's sweet that she was giving her patch away. That's great. But you're right. There's so many people
we got to get Pinnock back on the show, Don. Let's get, there we go. I'm sorry about that.
Well, let me just say, one of our focuses right now is to get to that other 6% that are still uninsured in Maryland. And let me tell you how we're doing that. We're doing that in several ways. In Maryland, we're leading the way. In addition to the Prescription Drug Board, we passed something called the Easy Enrollment Program. In 2020, Maryland was the first state in the country where at tax time, you check off. If you're asked, are you uninsured? If you say yes, then you check it off. And then you're asked, can we, in this comptroller's office, share your tax information with the exchange? If you say yes, then we get you enrolled. And we're working on making that better. That get thousands of new people enrolled.
That's just an automatic thing. I'm so poor. I don't know anything about it. I don't know taxes. I don't have health insurance. I didn't know that it was even possible, literally, right? And the state then knocks on your door and says, whoa, you qualify.
Yes, you hit it right on the head. We did focus groups. There are people who are right now, tens of thousands of Marylanders who are uninsured, eligible for free health care, and like you say, don't know about. We're trying to figure out one of the laws we passed this year, sponsored by Delegate Laura Cherkudian and Senator Jim Rosapep, says that when you file for unemployment insurance, which is a rough time for people, right? They lose their health insurance, they're connected to the health exchange. That's a great law. Another law.
Well, I just wanted to ask this because, look, why should everybody care? Why should I care that these 6%?
You should care. Good question. Good question. The reason you should care, number one, because we're all human. But if that doesn't get to you, when there are uninsured people, we don't let them die in the street, right? If they go to the hospital, they're treated, and they run up huge hospital bills. Who pays for that? They don't. You and I do. Something called uncompensated care. The more uninsured people are, the more uncompensated hospital care is, which is paid for.
By the way, I knew you were going to say this. On the social studies, on the Dundalk train that I'm on, I've always thought, like, that's not a good thing We're all getting screwed. It's just we don't know it. We do.
Yes.
We don't know it.
Yes, yes. And people are getting more and more to understand that uncompensated hospital care is bad for all of us. So when we reduce uninsured and make more people covered by health care, we all benefit. And that's why when a new law by Senator Brian Feldman and Delegate Ken Kerr provides additional subsidies for young people, because there are a lot of young people who say, oh, no, I don't want to get on, I don't need to get insured, but we want them insured. It keeps all of our premiums down. So we're trying to get them insured. And I want to focus on one other thing. Did you have a question?
No, go ahead.
One major law I want to really focus on by Senator Antonio Hayes of Baltimore City, a great guy, and delegates Eric Barron and Jazz Lewis of Prince George's County, is called the Health Equity Resource Act. This creates health equity resource communities because the pandemic, among other things, has highlighted the terrible health disparities between people of color and other people in Maryland and really across the country. There are communities in Baltimore City where within a few miles of each other, the age difference, the mortality, the lifetime living is different by 20 years. People die in the 60s in Sandtown, Winchester, and in the 80s in Guilford. It's not right. And one of the reasons is not good health care. So the Health Equity Resource Law will create health equity resource communities across the state, which will put resources into reducing health disparities. This was tried in 2012 under O'Malley Brown. It worked. It was not continued, but they created 5 of these. They call them health enterprise zones. They worked really well. They reduced health disparities, improved health outcomes. They were stopped. Now we're making it permanent. Health equity resource communities are another part. So these are great laws that passed this year.
Vinny, last thing for you, and I'll let Don wrap on this, but the 94% that are insured, and this speaks to my wife having millions of dollars of of coverage, and the patches that she gave to other women to keep them from throwing up and different things that happen. There's insurance, and you're like, well, only 6% of the people don't have insurance, right? What are the percentage where it's really catastrophic, like where I got insurance, but I got in a car accident and the bill is $800,000 and I'm only covered for $200,000? I'm still wiped out, right? Like, so insurance, I always hear that as, well, I got car insurance. What's your deductible? Well, I took a rock on my windshield, but the deductible was $1,000. So I took a rock on my windshield and it cost me $1,000, right? It's not insurance. That's out of pocket to me. I get the vibe that a lot of these people out of the 94% would still get wiped out if they had the wrong thing happen to them.
Well, first of all, a lot of that was before the ACA. The ACA did a couple of things that were very important. First of all, it says you can't deny somebody insurance because of pre-existing condition. Very, very important. You can't throw somebody off insurance because they get sick. You can't put lifetime limits on people. So that's one of the things you were worried about. That's no longer the case. Since the ACA, insurers can't say, well, we'll only pay you up to $1 million. No, you got to pay the full insurance. And this is very, very important. It provides that they have to put at least 85% of the money they get into healthcare, the insurance companies. So there's a lot that's better for everybody since the ACA. Now, it's not perfect. And there are some plans that still have like $5,000 deductibles and all the rest that aren't so good for people. But that's being improved by what Joe Biden and Kamala Harris did in the American Rescue Plan, where they added substantial subsidies to people so they could afford the better plans. So they don't have to get the bronze plans, which has the higher deductible. But a lot of the problems you were alluding to, Nestor, were before the ACA, now post-ACA. Now we have to do more. And one of the things that has to happen, which I'm hoping happens soon, is that those benefits from the American Rescue Plan for the ACA were only for 2 years. We want to make those permanent. And I think Joe Biden's gonna do that. Plus, I'm hoping that with Senator Van Hollen's leadership, we'll get the easy enrollment that we talked about nationally, so that everybody across the country at tax time can get enrolled. And we got to do something about high-cost drugs.
Sign them up to vote too while we're at it. All right, I'll throw that in there.
Before we let you run, and we're with Vinny DeMarco, president of Maryland Citizens Health Initiative, I can't have someone like you. I have two quick questions, and we'll let you get out of here. I can't let somebody on like you on here without me lobbying for my idea. I've pitched it to a number of our federal officials. I think the big idea that we could get people to buy into, Vinny, is to phase in Medicare for all. And what I mean by that is to take a look at it as a generational program and to pick a point in time, for example, July 1, 2022, and state that any child born in the United States of America after July 1, 2022 would be enrolled in Medicare for all, thus reducing the family health care costs for folks who still have private insurance because their children would now be covered for Medicare. We could put a specific cost on it, and we would then be phasing it in over a generation. Would it transition us to Medicare for all overnight? No, it would not. But looking back for my children and grandchildren, would they then be in a country that valued universal health care as the rest of the Western world does? Yes. Is that idea pie in the sky, or do you think that idea has merit?
I firmly believe that the right way, both from a policy and political perspective, to get to quality, affordable healthcare for all is to build on the ACA. It doesn't make sense to me to throw out the baby with the bathwater and start all over it. There's no reason to do that. The best thing we've got going for us is a smart ACA, but we have to do some things. We have to make sure the insurance companies don't rip people off. We have to regulate them tightly, and we have to do something about high-cost drugs. And we have to make sure everybody's covered. We can do all those things. We could do all those things in a politically viable way and make it work. So that's what we're focused on.
Well, and thanks, Vinny, for that. And then the last thing, we couldn't have you on here without talking about an issue that Nestor and I, we talk about it all of the time, and I wish we didn't have to. And that's, you've been such a leader on gun safety. Where are we now in the state and the nation? What do we need to do for guns? Because it drives Nestor and me crazy.
Well, there is an effective tool for reducing gun violence: licensing handgun purchasers. And states that have had that for decades have significantly less gun violence than states that don't, like New Jersey and Connecticut and Massachusetts, significantly less gun violence. We enacted a licensing law in Maryland in 2013. It's one of the heartbreaks of my life, Don, that I was watching numbers in Maryland drop from gun deaths after that law took effect until Freddie Gray. And then everything changed. But one of the things that's happening because
what's
of that
connect? Wait a minute, Vinny, don't gloss over that. What?
Yeah,
that's Nestor looked out the window. He lived Freddie Gray.
Yeah.
What's the connection between everything changing after Freddie Gray?
Well,
connect those dots for us.
Oh, I mean, everything, guns just exploded in the city after that, and we're still living through that. I'm not an expert on this, but it really, I saw gun deaths dropping after a law and then skyrocketing. But one of the things I want to emphasize is that because of Maryland's law in 2013, guns that kill people in Maryland before that used to come more from Maryland gun shops. Now they come from out of state. What we need is a national background check, absolutely, like President Biden's trying to get now. But beyond that, we need a national law to license anybody who wants to purchase a handgun. And, you should have on your show, here's who I recommend: Professor Daniel Webster from Johns Hopkins. I give you his info. He can give you all the lowdown of what works, what doesn't, what the federal government should do. Professor Daniel Webster. He would be great for your show.
Legendary name there. Vinny, a pleasure to visit with you. We'll send everybody out to Healthcare for All and learn more.
Healthcareforall.com. Healthcareforall.com.
Healthcareforall.com. There you go. We'll get together with a crab cake at some point with you. And
you have the crab cake, I'll have the veggie burger, and we'll have fun together.
I'll pretend you're eating a crab cake, and I'll pray for you. We are WNST.net, AM 1570, Towson, Baltimore, and we never stop talking crab cakes in Baltimore Positive.